Welcome to Baby Bump Theory. I'm Dr. Asma, and today I wanted to speak to you about something that is quite common, actually affects most moms, and that is mood changes after pregnancy, and we'll specifically talk about postnatal depression. So, in fact, there's a proverb, an African proverb that says it takes a village to raise a child. And I love this proverb because it's so true. But historically, all new parents would have had a sort of village around them of family, extended family, friends, neighbors, communities, etc., that would all have a part to play in supporting them and raising the children. However, in this day and age, it's more and more isolating and in fact lonely, raising a child with very little support. So it's not uncommon that new parents do feel overwhelmed, anxious, and can get a bit upset during the early days. In fact, most women, about 80%, will have something called baby blues, which basically starts a couple of days after birth. It's thought to be because of hormonal changes during the delivery, and also the fact that there's a new normal that they have to adapt to. So it often relates to feeling irritable, overwhelmed, anxious, tearful, etc., and can last for about 2 weeks until things get a bit more stable. Some people, however, and this is about 10 to 15%, okay, so more than 1 in 10 women will go on to develop something a little more severe and longer lasting, which can have longer term effects. And this is what I mean by saying postnatal or postpartum depression. A very sort of a more rarer psychosis that can occur is called postpartum psychosis, and this is much more severe and does need medical intervention quickly. This usually involves the mother having delusions, hallucinations, and getting much more out of touch with reality, and this is severe, like I mentioned. So going back over postpartum depression, what symptoms would a mother experience? So basically it's feeling low mood, sad, anxious, tearful. There's lots of feelings of kind of hopelessness. There's no hope for the future being bright. It's a feeling of worthlessness, feeling that you're not a good mother, feeling that you're feeling guilty, feeling that you're not doing a good job for your child. It also leads to withdrawing sometimes from family and friends, withdrawing from activities which they would normally enjoy, in fact not even showing any interest in things that they would like normally. It does affect mother-child bonding, unfortunately, and can also lead to concerns with child's development. So this is why it's really important to try and sort of catch this early and try and prevent it lasting very long or developing into a more severe version, which would then have long-lasting effects on the whole family. Why does it happen? I mean, it's not really understood why, but there are many factors that can increase the risks. Okay, so in terms of, like I mentioned, about not having that sort of support, so feeling isolated, no social support, not getting much help with other tasks that they need to do, also perhaps having any health issues during the birth, traumatic birth, maybe the baby has health issues or special care needs. Twin pregnancies or multiple births lead to higher chances of developing postnatal depression. Also, the history of the mother, she may have had depression before, or there may be a history of in the family of depression. Other than this, I think the fact that most mothers expect to fall into motherhood naturally and think that it will happen, smoothly, and probably don't anticipate the amount of responsibility and needs that the baby has, and how much responsibility comes on them. And there's a lot of feeling of overwhelm, and maybe difficulty coping sometimes. Mothers also don't like to ask for help, and this can be another reason that things do get worse for new moms. Dads feel it too. So about 1 in 10% of men will feel overwhelmed, perhaps helpless, and even uncertain about the future when a new child is born. And they also, we should know about symptoms that they experience to recognize it and try and help them as well. So, if you are a new mom or have had a baby recently or are experiencing feelings of low mood, what can you do? Well, the first thing is, it's not your fault. Okay, it's not something that you need to be ashamed of or afraid to discuss. You should talk to people that you trust, family members, friends, healthcare professionals, and you should try and get as much help as you can for the things that you can delegate, whether it's help with the baby or with other tasks around the house. And you do need to get a little bit of time out to feel like yourself, to do something that you enjoy, whether it's talking to a friend, whether it's going for a walk. In fact, movement, exercise will help boost your mood even more. Getting time to rest and sleep, because let's face it, new moms get very little sleep, and to be honest, when you're sleep deprived like that, I think anybody would be experiencing a low mood. So these are the things that you can do. As for the rest of us, it's worth knowing about this, spreading the awareness, sharing this information, making these new parents feel like they are supported, and anticipating their needs. So whether it's just a matter of them needing a meal or help with some household tasks, or even help taking baby off them for 10-15 minutes so that they can shower in peace. The things that small simple things that give us joy. It's anticipating that, and then basically being the village, supporting these parents and raising children all over the world. I hope this helps, and please do feel free to comment or share or ask any questions that might have come up. Thank you. Bye.